Pursuant to House Resolution 276, the gentleman from Pennsylvania, Mr. Thompson, and a member opposed, each will control 5 minutes. The chair recognizes gentleman from Pennsylvania.
Thank you, Mr. Speaker. I yield myself as much time as I may consume.
Gentleman is recognized.
Thank you, Mr. Speaker. Thank you to the chairman and ranking member of this committee. I rise in support of the Thompson-Berkeley Amendment number 29, which is nearly identical to H.R. 1832, the Bipartisan Service Members Telemedicine and E-Health Portability Act, or STEP Act. This amendment will bring essential reforms to how our service members and veterans access care. In common sense, no-cost changes to how the Department of Defense administers health care. Currently, the Department of Defense has limited ability to allow its healthcare professionals to provide care when the patient is in a different state. Department of Defense's hands are also tied when it comes to civilians or contractors who have stepped up to fill shortages in desperately needed positions, especially mental health. As a result, many in the military are required to travel long distances in order to access care. And this can add undue stress and financial burdens to everyday lives of our servicemen and women. Too often, these circumstances contribute to those who need help the most going without, and in some cases, falling through the cracks. By removing location requirements, this amendment will allow the Department of Defense qualified and credentialed healthcare professionals, including contractors and civilians, to get to their core mission of helping their compatriots in need. This will allow our National Guard, Reserve veterans, and retirees quicker and more efficient access to care, and open the door to allow for the modernization of the Department of Defense healthcare delivery. This amendment will allow for new technologies in telephone and internet communications to expand into the Department of Defense, which will greatly expand access, especially in rural America. It will also allow more specialists to be involved in providing care. When it comes to behavioral health, the Guard and Reserves have been hit especially hard. This amendment will allow the Guard and Reserve to access behavioral health care right here at home, from their home immediately when they need it most. This has been a very important issue to me. I've met with our military and veterans over the past several months and closely examined the behavioral health issues affecting our young men and women. Recently, Vice Chief of Staff of the Army, General Peter Chiarelli, said, and I quote, "The Army, like the larger American society, is suffering from a shortage of behavioral health specialists, and that is in fact a national crisis. Efforts in telebehavioralists to meet with patients through teleconferencing technology, for instance, could increase the effectiveness and reach of a limited number of providers." But the general then said, there are challenges regarding the credentialing and licensing of specialists to work across state lines. Mr. Speaker, this amendment will directly address this issue and has the means to dramatically improve and change how our nation's warriors access care. With these restrictions removed, it opens new doors to how the Department of Defense can administer and expand its health care programs. To be clear, there's nothing in this amendment intended to change nor be the basis for any future change to Department of Defense or state-based scope of practice, laws, or regulations. Ultimately, this amendment is about technology and modernization. It's about new ways for service members and veterans to access care. It's about fulfilling a pledge to take care of our veterans regardless of where they live at no cost to the taxpayers. No new cost to the taxpayers. This bipartisan amendment has broad support from the Pentagon and military community. Some of the most notable groups include the Air Force Association, American Legion, the Association of United States Navy, the Enlisted Association National Guard, Iraq and Afghanistan Veterans of America, Mental Health America, Military Officers Association of America, National Guard Association of the United States, Reserve Enlisted Association, and the Veterans of Foreign War. I ask my colleagues on both sides of the aisle to support this common-sense, bipartisan, no-cost amendment. As Memorial Day approaches, we owe our veterans and service members as much. I thank you, and I reserve the balance of my time.
Reserved. Member seek time in opposition. Gentleman from Washington.